Hello and welcome back to the channel. I'm Dr. Holly and I'm a clinical psychologist working in the UK. Today we are going to be covering the biggest Clinical Psych interview mistakes. So these are interview mistakes that so many people make when interviewing for the Clinical Psychology Doctorate here in the UK. And I'm also going to give you some tips on how to avoid these mistakes and things that you can do instead. Hopefully they are helpful. Just for a bit of background, I interviewed 4 times across 3 years, but I applied overall 6 times. So I know the process fairly well, and I do a lot of mock interviews with aspiring psychologists and have done a lot of this sort of work before. I've never interviewed on a course in terms of as an interviewer, so just so you're aware of that. And also I would caveat this with all the courses are different, but these are some of the things that I found in doing mock interviews and my experiences that are the biggest mistakes and things that actually are really helpful ways of kind of navigating those mistakes. So let's get into it. Firstly is preparation. And what I mean by that is very specific. It's over preparation, which is not guided by reflection. So preparation is obviously really important, but it needs to be focused and it needs to be specific to you. And I know I give a lot of very general advice about decline interviews, but it is quite hard to give general advice because everybody comes from a different starting point. So some people may have years of experience and have had years of supervision with a brilliant supervisor who's really fostered their reflective skills and has done loads of practice with them, and they kind of really know what they're going to bring into training. Some people don't have that, and some people will never have that before getting onto training. And so you're coming already from a very different position. It's not that you're at a disadvantage at all. It's not that. It's just you're coming from a different position. So my advice to person A would be very different to my advice to person B, if that makes sense. So, you know, what I would say to either person A or person B is that should be focused. That reading and that preparation should be very focused and based on what you need. So I over prepared on my first interview, and it was a car crash. I didn't really know what I was doing. And I just read everything that I could think to read, just generally about, you know, everything about the NHS and everything about everything. I just read so much stuff that I was bursting with it. But it also in a very unhelpful way, like I couldn't recall any of it in a meaningful way. So yeah, I would definitely advise not just generally reading loads and loads of stuff, just because that's the only thing you can think to do. I appreciate the temptation and it is hard, but what you need to be trying to do is take some time to reflect on the things that you think you need to learn and read up a little bit about. So for example, if you couldn't talk about a research paper, you know, I'd probably find a research paper that you would be able to then talk about. Is that sort of thing. If you wouldn't have a couple of case studies you could talk about, I'd try and think about a couple of case studies. But the other thing, there's a couple of different ways you can approach it. So you could come up with a list of topics that you'd be nervous about answering. So it could be like, you know, prejudice and power and anti-racist practice in the NHS. That could be that sort of thing that feels a bit uncomfortable. Or that could be something you feel really like, yeah, I know my opinions and I know what I think we should be doing, and I understand a bit of like wider literature around this and I feel really positive about it. Again, everybody comes from a different starting point. But also I'd have a list, if you're going to have a list that you're worried about, I'd have a list that you feel comfortable with as well, because you probably need to spend a little bit less time doing the stuff you feel comfortable with and maybe a bit more time on the stuff you feel worried about. I would say there's a bit of possibly a bit of a danger with that though, is that you are unlikely to ever feel 100% comfortable with any topic that they can throw at you in an interview. Okay, so don't make that the goal. Don't say, right, I need to read everything on this list until I don't feel worried about it anymore, because that may not be possible. So the other way that you can do it is writing a list of your competencies, actually, what you feel you're competent in so far. You can compare that then to the trainee clinical psychologist job description, which is usually available on Clearinghouse. So you could compare it with that and say, these are the competencies of a trainee. Here's the competencies I have. Okay, where are the gaps? What do I need to spend a bit of time thinking about? So you could do that. You also could do here are all my competencies. Here is how I've developed each competence, you know, so with kind of different experiences you've had and things. And this is then how it links to training and how these experiences and these competencies are going to help me on training. So that is probably, you know what I mean? Instead of just reading anything you can about clinical psychology, it's thinking about what you need and focusing on it. It may sound like a really obvious thing, but it did not occur to me on my first go not to just read everything that I could read about it. I didn't really know about reflective models. I didn't know about reflective practice. And if you're struggling to come up with those things, then probably have a go at using some reflective models. And we've done loads of videos on them. So have a little look. Before we go on to number 2, I do briefly want to talk about the range of guides that we've created that are available for purchase on our Shopify. We have a specific interviews handbook. So we have one of these. We actually only have 2 physical copies left, and we're not going to get any more because they just sit in my house for a year. So yes, we've got 2 copies of the physical one left. So it's got spaces for you to kind of write stuff and think about things. So we've got that. We've got PDF downloads of all of them. So there is an interview handbook, which is exactly this one, but you can get it in a PDF. And we do a reflective practice handbook as well for aspiring psychologists. So there's a whole range of them available. And we do charge for them, and that is only so we can continue to offer the support that we are able to offer off of YouTube and Instagram. Without that, it becomes very tricky. But for any reason, you do never ever need to give me a reason, but you can email me and ask for a free copy, and I will send you a free copy of it. You know, I really care about making it accessible. So if people can afford to, then brilliant. We do try and make them really affordable. But if not, that's fine. There's no need to give a reason. So get your hands on those, because it gives you all of the different tips that we've covered before, and it gives you lots of space for kind of practice and reflection as well. So we've talked about preparing for the interview and what that looks like. Now we're going to talk about 2 mistakes people make during the interview. The first of which I feel very strongly about, and it's jumping straight into an answer. I do want to caveat this though with some people find that really works for them, and they are able to do it and give a succinct and clear answer. Brilliant. More often than not, I don't think that's the case, and it's not the case for me, definitely. I remember when I was practicing for interviews and, you know, going through that process, I remember a pressure that probably came from myself, that I needed to show that I didn't need time to formulate anything and I could just go straight into it. And that made me a great psychologist. It doesn't actually. What makes you a better psychologist really is knowing yourself. And if that works for you, brilliant, go for it. But if it doesn't, you're not going to lose any points by taking a tiny chunk of time or even a breath to just think about what that question is and think about some ways that you can answer it. You know, you're not going to lose out. If you're taking 2 minutes out of 5 minutes, you know, to do that, then yeah, probably. But taking a bit of a breath and taking 10 to 30 seconds to formulate an answer, it usually results in that answer being more succinct, more competently delivered, and you will come across as more confident as well. So, I find it much, much more effective. So what I often say, what I often model with people, and what I definitely said in my successful interview was, I've got lots of thoughts about that question. Yeah, I'm just going to take a minute to write down a couple of my thoughts and order them just so I can give you a good answer. You know, something like that is fine. Or, you know, that's really interesting. Wow, my mind is going 100 miles an hour. Let me take a minute to just think about how I want to answer that. And even, you know, that's fine. And I used to write it down. I used to write down like a brief plan. But what you're doing is you're kind of modeling what you might do in a session. You know, do you jump straight into like answering something or responding to what a person says, like a client says in the therapy room? Or are you going, okay, let's consider that? Because actually we are quite a considered profession more often than not, and we do take the time. So I think you're modeling that almost. You know, in therapy sessions, I'll sit there and go, wow, I've got loads of thoughts about what you've said. I'm wondering about this and I'm wondering about this. And what about this? You know, we do that. That's a natural way that we work. So in an interview, you know, it's a high pressure situation, but you can do that. So even just taking a breath is helpful, but if you can, you know, writing down a bit of a plan. And the structure that I took that really helped is, and I do think this kind of ties in, like when people jump in without a bit of planning or a bit of a breath, there's often no structure and it can be quite waffly and you don't quite know where you're going or where you're going to finish. Having a bit of a structure, if you know where you're going to end, you will always come across as more competent. So the structure I liked was introduction to thoughts, kind of, I've got this thought and I've got this thought, I'm thinking about X, Y, and Z, and then thinking, and I'm going to focus on A, B, and C instead, whatever it is. So you can have then point 1, point 2, maybe point 3 if you can, to answer the question, and then link to being a trainee clinical psychologist as the end. That's what I would do. And this isn't always possible during every question, but I found it really helpful for the majority of the questions. And like I said, I found it really helpful to write down my thoughts with a brief plan, although some courses don't really allow for that, unfortunately. But it's worth checking with the individual course. And our third biggest mistake for DCLIN interviews is not linking your experiences and answers to being a trainee, because that is what you're interviewing for. And a lot of people will answer the questions without answering that bit because it's unsaid more often than not. So there are lots of questions where you won't be doing this, like design a research study. It's quite hard sometimes. You might say something like, and that's the sort of research I'd like to do on training, or like, I don't know, on training, I would obviously take a little bit more time with my research supervisor to formulate that properly, or whatever, because what you're doing is showing that you understand what it's like to be a trainee. That's really important. So yeah, I find it a really helpful way to end an answer, because like I said, if you know how you're going to end your answer, it's much more convincing than blah, 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 point. Yeah, I think that's it. Yeah. It's much more convincing if you say, and that's why I think I'm really ready for training, or and I'm really looking forward to doing that sort of work on placement during training. It's so much more convincing, isn't it, than just like, doing it without. It also makes you sound like you know what you're interviewing for. You know what I mean? Like, you are interviewing to be a trainee, and that's important, and not many people do it. I don't know why. I think maybe because it's not a said part of the question a lot of the time. But you need to demonstrate that you understand what training will involve, because they're never going to ask you, what does training involve and how are you going to be ready for it? They're probably not going to ask you something like that. So you need to show that through your other answers. So those are my 3 biggest DCLIN interview mistakes. Let me know if you have any other ones and what you did to navigate them. Thank you so much for watching, and wishing you the best of luck for your interviews. Take care. Bye-bye.